So hi, I'm Ben Travis, the Chief Executive, and I wanted to start off by saying a huge thank you for all the work that you've been putting in over the past few months. I know the past few months have been really tough for many people, but I wanted to reflect on some of the improvements that we've made over the last year, but also to let you know about some of the work that we've got planned over the coming months. It has felt really tough over the past few months, and in some respects it's felt like winter hasn't actually properly ended. Certainly when you look at the demand for our services and the fact that here we've actually been having to use the external corridor to treat patients, which we know is absolutely something that we look to avoid at all costs. And we also know that despite lots of work we've been doing about trying to I suppose improve the culture in the organisation, that many colleagues haven't actually seen a great deal of difference in their day-to-day work. So I know it has felt quite relentless, but we also did want to think about just some of the things that we have achieved over the last 12 months. So over the past few months we've managed to successfully open wards 22 and 23 here at the QE, which we did on time and on budget. We've made some huge improvements to the daycare services we're able to provide on this site, and we've also made the decision to ring fence surgical capacity at Lewisham site, and that's particularly looking at Linden Ward. Also at Lewisham we've recently opened the dialysis centre, and as you'll all be aware, over the past couple of months we have implemented the new iCare system around electronic prescribing and clinical documentation, which, despite having taken a bit of time to get used to, has actually gone really well. We've also rolled out mobile working for many of our staff who work in the community, and that has been really well received by them. You'll all be aware, I'm sure, of the CQC inspection report that was published in January, where they noted significant improvements have been made across the organisation. You know, there's a lot more to be done. It was great that they recognised that we had made some significant improvements, and it's a fantastic place to be where actually our maternity services across the whole organisation are now rated as good. We've also started a big conversation to be continued over the next months and years around how we work together. And we're delighted actually that our vacancy rate now is significantly down from last year, and I think is the lowest it's been over the past 3 years. And added to that, what consultants say about working in this organisation has really improved as well. So 2017, 52% said that they felt engaged in the business of this organisation, and now that's up to over 70%, so really significant. And we've managed to achieve all of this whilst there's been a huge amount of change in the leadership of the organisation and also in terms of the way we set our divisions up. Already across this organisation there are dozens of projects taking place to improve the quality of the services that we provide. But what we're going to be doing in September is launching a trust-wide approach to improving the quality of the services that we provide. This will take the shape of training for all staff who've got ideas, so that they can come up with their ideas of how to improve care, and the organisation can really get behind them and support them to deliver these in a timely way. We've also commissioned some work around values-based leadership training, and again I hope many of you have received invitations to a one-day programme. These have gone out to over 4,000 colleagues in leadership and supervisory roles, and the purpose is to have some time to reflect upon how we lead with care and compassion, and make sure that all the time we're doing it in a respectful way. And I really hope that this will help us with this conversation about how we work together. We're also looking forward over the autumn for several colleagues from overseas to be joining us. We had some successful campaigns abroad to recruit more doctors and nurses into the organisation, and those staff should be joining us over the coming months, and we're really looking forward to them starting with us and the difference that they should be able to make for the care we can provide. And also people will recognise that in our divisions there are quite a few senior posts which are vacant at the moment, and we have very recently launched a major recruitment campaign to try and again fill those posts, either giving opportunities for internal colleagues, but also possibly get some external people into the organisation as well, and that should be taking place over the next couple of months. So, in summary, I know it has been tough, and it probably will be quite tough over the next few months, but I think we should all recognise that we have made a number of improvements, and we actually have a lot to be proud of. So please bear with us. We are working on further improvements, further things that will make a difference to your day-to-day work. And I just wanted to end off by saying a huge thank you for all the hard work and commitment you've shown over the past few months, getting us through the winter and getting us through the spring. Thank you.